Okay, hello everyone. I'm Yazan Almasry. I'm a fourth year medical student, and today, hopefully, I'll be helping you with understanding how to get an A, hopefully, in the OSPE. I tried to cover as much as possible. You can see the scary number in the corner, 57. I'm sorry for the number of the slides, but I really just wanted to cover everything. I'm not saying this includes every single thing that you guys studied, but includes a lot of stuff, and hopefully it will be beneficial. Before we get started, I just want to tell you guys that, mashallah, you guys got really far, and you should be proud of yourself for reaching this far. And the exam is getting close, you're getting nervous and all of that, and I understand. And hopefully this will make you less nervous, more ready, and inshallah, you guys will all do great, and you'll be the doctors in the future, inshallah. So, the way I'm gonna do this is I'm gonna go about like questions, like for example, hold on. So for example, this one, can you guys see the screen? By the way, feel free to unmute, type in the chat, do whatever you want. I don't mind anything. And if you have any questions, stop me at any point. That also works. Hello, doctor. Wallahi, not doctor, but thank you. I appreciate the. Okay. So, can you guys see the slide? Yes? Okay, perfect. So, we can either go through this slide, for example, you guys answer, and then we move on and explain, or we can do the muscles first, then we answer their question. What do you guys want? Oh, someone is already answering, mashallah. Okay. Okay, I guess we're just gonna do the question. Okay, so this question is asking which muscle has this type of fascicle? Okay, fascicles, and give an example for this type. Okay, so first of all, this is the muscle. So what do you guys think is the type of muscle? Someone in the chat answered fusiform. Okay, and the example is bicep. So both of you guys are correct. So yes, also digastric is correct. Is there any other fusiform? Yes. So we'll do this. Okay, so, oh, sorry, my screen. Okay. Okay, so we have multiple types of muscle, okay, or like the fascicles of muscle can be arranged in multiple types. Okay, one of them is fusiform, and fusiform basically means that the muscle has a belly. And as you can see, like this muscle is like straight and then suddenly it has a belly. Okay, so that literally what fusiform means. If you see any muscle looking like this is known as fusiform. Okay, we have two types of muscles, or two examples mentioned for fusiform. We have digastric and biceps. And so the exam could either tell you, for example, what type of muscle is this? And the answer would be fusiform, or would tell you, give me an example for this, and it would be digastric or biceps. Is that clear? Should we move on? Because the next question will be similar to this question. Clear. Okay. If one student doesn't understand, I'm going to re-explain. It's fine. If you don't understand, we can re-explain. It's fine. The more we re-explain, the more you get it right, the more we repeat. Okay. Okay, everyone's staying clear, so I'm just going to move on. Okay. Cool. So, what type of pennate? Which muscle has this type of pennate? Sorry, and mention the type. Okay. So, what is the answer? And multipennate. You guys, can I like point out something that's really, 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 really important for OSPE? Never, ever answer the first part of the question without the second part, because they will grade you down for this. Even though you know the information, you have to answer both information. Make sure to read. I've done this multiple times, and I was so sad after the exam because I would know the answer, but I forget to read the rest of the question. So just make sure to answer the question fully, especially in the exam. Okay? So the answer is multipennate. And the example is deltoid. That's perfect. That's the only example we have for multipennate. So if you guys remember, we have something called pennate. And it's divided into three types. Uni, which means one. Bi, which means two. And multi, which means multiple. Multi. I can't spell anymore. Okay. So 3 plus. Okay. So can anyone give me an example for unipinnate? Sartorius. Okay. So extensor digitorum longus. Yes, yes, yes. That's correct. Sternocleidomastoid. Okay. So for the ones that are saying Sartorius, it's not correct. And I'll explain why. Because we have two types of fascicle from the beginning. We said we have parallel and we have oblique. Okay. Under oblique, we have the pinnate. And under the parallel is just the parallel muscles, which basically is sternocleidomastoid. I'll just write sterno. And the other one, which is the sartorius. Correct me if I'm wrong, though. This is what I remember. So for pinnate, whenever we say pinnate, don't mention the ones that are parallel, because this is a different category on its own. Tamam? So this muscle is deltoid, and it's multipinnate. Is the question clear? Yes? Okay. Okay. Clear. Okay, which of the following is an example for a bipinnate muscle? This is a very straightforward question, and like, can we pause the recording for a second? Please. If it doesn't come this year, it's fine. So just know this, okay? Great. So everyone knows it's rectus femoris, rectus femoris, rectus femoris, femur rectus, close enough. Someone said bicep brachii. So for that person that said bicep brachii, okay. No, but I can see where you're coming from. Bicep brachii would have this type of shape. We'd have two bellies like this. But this is different. This is not bicep brachii, this is rectus femoris. So rectus femoris. Yes, exactly. Bicep is fusiform. Okay. Is this clear? For the person who said bicep, is it clear? This is more like bicep, okay? But it has two heads. This is probably why you were confused. And that's completely fine. No. The bicep is not bipinnate. It's a fusiform muscle. Unless they taught you otherwise. If someone taught you otherwise, let me know, because that's what I remember and that's what I studied. Bicep is fusiform. It's not bipinnate. Yes. Okay, we can move on. So this is like a cheat sheet basically for the OSPE. I know it looks overwhelming. Just you have to know, for example, parallel muscles, the examples for it, like sartorius and sternocleidomastoid. For fusiform, it's bicep and digastric, circular, orbicularis oculi, triangle, pectoralis major, and you guys get the point. I just made this for those who want to review from my slides. Instead of just going through like 14 different slides to revise everything, you can just memorize this slide and you'll know everything. So one way they could bring you the question is, for example, they will tell you this muscle or show you, either tell you or show you, this muscle is parallel. Give me an example for it. And the answer will be either sternocleidomastoid or sartorius. Okay. What is the tricep considered? Okay, you beat me in this question. Honestly, I don't remember. But don't overthink. You've been given examples and just memorize them, honestly. Don't overstimulate yourself. You will know in MSK, so don't worry about it for now. Is that fine, or do you want me to Google it for now? Tamam. Okay, tamam. Perfect. So I also put the pictures. So the way they might ask you, they will tell you, for example, this is a triangular muscle, right? They will tell you, for example, name an example for this muscle. I want you guys to name an example for this muscle, for example. Pectoralis, perfect. Pectoralis major, perfect, perfect, perfect. You guys get the point. Name an example for this muscle. Oh, sorry. Name an example for this muscle. I know the name of the the muscle is a bit tough, but hey, you will eventually know it by heart. Okay, perfect. Everyone is getting it, mashallah. Do we need to know how to spell exact? No, no. I wouldn't have been a fourth year if that's the case. So just telling you. So can you give me an example for a parallel muscle? Will we write the name? Maybe, maybe not. Um, I hope not. I hope it's an MCQ, but I don't know how it is. Like sometimes they make you write, sometimes they don't. Even if you just are close to the name, yes. So both of you guys mentioned both examples correctly, and that's perfect. So everyone is getting, mashallah, the answer is correct. So this is the part for the muscles. Is everything clear for the muscles before we move on? Is everything covered? I wish we have all of these for they're easy to be honest. Yes, it's easy. Like no need to go into so much details. It's actually like easy. Is everything clear about the muscles? All the examples, memorize them. Know which one is parallel, which one is fusiform, which one is circular. Know how a circular one looks like. Don't just know, for example, circular is orbicularis, ocular, oculi, and then when they get to you this, you don't know what's that. Okay, you have to know. You have to know that this is triangular, for example. This is multipennate. This is bipennate. Okay, you guys get the point. What's a stapedius muscle? Um, this is the muscle for like for the for the ears. I don't know who mentioned it, but don't worry about it. Not for now. Okay. طيب. We'll move on. So, can you guys answer this question? Axial, 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 axial. Okay, okay, perfect, perfect. So, whoa, I'm doing new stuff today on my laptop. I don't know what's happening. Okay, sorry. Oh, it's happening again. Okay, so we have two types of skeleton. We have the axial skeleton, and it's axial because it's in the axis. It's the axis of the body in the middle. Okay, that's axial. Okay, and we have what's the other type? Do you guys know what's the other type? Appendicular. Okay, perfect. Now, what does appendage mean? Does anyone know what's an appendage? Attachment, limb. Okay, that was the word I was looking. Yeah, it's an attachment, and it's used as a they use it for the limb. Okay, so when we say appendicular, we're actually referring to the appendages or the arm, the leg. You know what I mean? So this is why it's called appendicular. So if you want to remember it, appendicular is for the appendages or the arms and the legs. Axial is for the axis or in the middle, the vertebra, the ribs, and the skull. Okay? Yes, upper and lower extremities is the appendicular. Is that clear? Am I going too fast, too slow? Am I doing well? Do you guys want me to go slower, faster? Am I skipping over something? Please let me know. Don't be shy. Great, clear. You're doing great. Thank you for the compliments, I guess. Perfect base. Great. طيب. Okay. What type of bone of this is this? You guys, honestly, when I saw this first, I answered incorrectly because I don't remember the information that has been taught in foundation. But then I would understand for those who answer incorrectly because I just got it today. Type of bone of this. Someone answered scapula. That's correct. That's the name of the bone. But we said in the question, what type of bone is this? That's why it's really important to read the question well, so you don't lose a mark for something you know. Irregular. Some say it's irregular. Some say it's flat. Okay, so this bone is a flat bone. Honestly, when I saw the slides first, I thought it was irregular, but turns out it's flat. And the reason is because it's more flat than irregular. Do we need to remember the names for these? Just the major ones, but I don't think you need to know all the names. It's better to. It doesn't hurt to read them and to recognize them in the exam. It looks a bit irregular. I agree with you, and I thought it was irregular, but this is a flat bone. Okay, and like this is proven by its flat surface. This is flat, and you guys have seen it probably in the lab. If not, once you see it in the lab, you'll notice that it's an actual flat bone. Okay, so please remember this. I put this specifically because this will trick people to think that it's irregular, but no, it's flat. The pelvis is irregular, yes, and we're coming to this, don't worry. So, is that clear? The type of bone, it's flat. Can we write scapula? You can write, the more you write, the better. The less you write, the worse. If you want to write more, that's fine. No one is going to mark you down for writing more. Even for SAQs. Is it clear? Do we move on? Yes. Okay, we're doing great. Can we just write short answer, yet straight to the point? Yes. So personally, I would say, for example, if the question is like this, and you know the answer for sure, you would just write flat bone and move on. If you were doubtful about the answer, I would write, for example, flat bone, then add the scapula, just so they see I actually know what I'm talking about. You know what I mean? But it's better to write like the whole information, like with the scapula, so they see like this student actually knows what he's talking about, you know? Yes. If you don't know what they want exactly, write more. Always write more. Yes. They're not gonna mark you down for writing more. Is there? No, there is no word limit. But also don't write an essay. You're just gonna give them a hard time. Tamam. Yalla, let's move on. If I skipped one letter or something, are they gonna skip the answer? No. If you don't write it correctly, they're not gonna mark you down as long as it's close enough. Okay. If you write, for example, so sternocleidomastoid, I'm probably gonna write it wrong now, but let's say sternocleidomastoid. It's really long. Let's say, for example, you write sternocleido. I think. Wait, what am I saying? They will accept this probably because they know what you're trying to say. Just try to write it as close as possible. Please, don't memorize the spelling, but try as close as you can. Okay, moving on. Which type of bone is this? And give an example for this bone. Remember, always write the full answer. Don't just write part of the answer because you're not going to get the full mark if you do so. Sesamoid, patella, sesamoid, patella, sesamoid, bone, patella, sesamoid. Okay, okay. Sesamoid. Okay, perfect. Everyone is answering correctly, and the answer is sesamoid. So this is a sesamoid. And the example, the classical example for this is the patella. Patella. Do you guys know where the patella is? Yep. Okay, great. Great. You guys know what it is. Is this question will be 2 marks? It'll be written in the exam how many marks per question, don't worry. طيب. Oh, I should probably mention, do you guys know that there is no backward navigation for OSPE? Or is this a new thing, new information to you? For OSPE specifically, there is no backward navigation. For everything else, there is backward navigation. Take your time, don't rush. Um, it's fine, don't stress out, don't rush, it's fine. Probably you'll answer the question in no time. You'll recognize it. Just like, for example, how do you recognize this is a patella? You will do the same, inshallah, in the exam. Inshallah, even easier will be the exam. Okay, everyone knows this. Should I move on? Is there any other example for other than patella? I have a list of example. We can check once we reach there. Okay. Would they ask the function? Maybe not. I don't think so, honestly. I don't think they will ask about the function. It's not, and it's not something that has been explained in the lab, and probably they won't ask. Okay, in 15th, what did they ask exactly? Flexion, extension. Also, you have to keep in mind, you had different lab material than we did. We didn't have HLS, we didn't have heme. We had different. In my lab, there we had a station about anterior, posterior, medial, lateral, all of this. For you guys, I think it's a lecture. It's not it's a lab station. But either way, we can get back to this later, and I can explain. I can explain whatever you guys want. I don't mind. We can get back to the function later, and I can explain it in case it comes in the exam. Okay. In case it does, patella reduces the friction. That's the function of the patella. Okay. I'll write it down here so you guys have to watch me write it so you never forget it. Reduces friction. Okay. So this is a summary for the bone. Remember, axial skeleton is in the middle, appendicular is to the sides, the appendages, the arms and the legs. Long bones, I wrote the names. You don't have to know every single one. Just in case, I would say read them, just in case. I don't know if you have to know them. I don't think so. They will just, for example, give you like the images and say what type of bone is this, okay? In case the name was there, I put it for you guys in a summary. How long is the OSPE session? You will see, like once you download the exam, you will see. They will basically tell you how long it is, and you will know from there. They will tell you. Humerus was one. Okay. So I think these are the type. I'm not gonna go through them. I'll just keep them for you guys here. But I would tell you, for example, aren't the ribs long? No, the ribs are flat. This is a rib. Okay, thank you. Okay, so let's say, for example, they give you this image, and they might ask you, so that the way they can ask you one of two things. Okay, the first thing they will ask you, type of bone. So I want you guys to answer in the chat. And the second thing they will say, name this bone. Wait, name. Pneumatic. Is there a difference between it? Yes. Pneumatic is basically for airspace. It's for think in the face, okay? I'll explain why they're pneumatic, just so you know. So this bone is pneumatic type of bone, and the name of the bone is ethmoid. It's even written here, Yani. You don't have to do much thinking. And this one is the maxilla. So the reason why we have pneumatic bone in the what's it called? In the head or in the skull, like in the ethmoid and in the maxilla, is that to make the skull lighter. Like if the bone is doesn't have these cavities, it will be really heavy. And think about like having to carry your head every single day, and it's heavy. We already have enough worries, so we don't we don't want to worry about carrying our head as well. So just that's why we have holes in the in the bone in the face, like in the ethmoid and the maxilla, so that it's lighter. Okay? So remember the two bones, the pneumatic bones, is the ethmoid and in the maxilla. And this is the tarsals and the carpals are short bone. The short bones, they are shorter than they are long. That's why they're called short. Okay? They are wider than they are long. So this is, you can see it's wider here than its length. Irregular bones, they're just straight up irregular. Yes, yeah. If they ask what type of bone, answer pneumatic. Don't answer irregular. Miniature bone, they fall under the long bones. Sorry, and clavicle is modified long, if I remember correctly. Yes, modified long bone is clavicle. Here you can see it. Tamam. So they might ask you, for example, they will point at this bone and be like, what type of bone is this? You will say irregular. What bone is this? You'll say it's the sacrum or the coccyx. So this is the coccyx, this is the sacrum. Okay, or they might ask you, what is this, for example? You'll say it's the vertebra. Or what is this? This is the mandible. What is this? This is the hip. Okay? Is everything clear? Am I confusing you guys? Am I explaining? Can someone say yes in real life? It's been like a while since someone spoke. I just
Yes.
I'm hearing the echo of my voice. Please, someone interact. Okay, thank you.
Yes.
Okay. We can move on. Okay. So we finished the muscles. We finished the bone. Now we know what to expect in the bones and in the muscles. Okay. Now we're gonna move on to the autonomic nervous system. Did anyone do a PAL about the autonomic nervous system or not? Or you guys are not sure? Yes? Okay, okay, great. So I'm gonna go through this quickly. So the easiest way to remember what's sensory, what's afferent, what's efferent, what's ventral, what's dorsal is this mnemonic. It's called same Dave, okay? Same, okay, if you put it sensory, afferent, so the afferent is basically sensory, and motor, efferent. So the efferent is motor. And Dave, so dorsal afferent. So the dorsal part of the spinal cord is sensory or afferent, and the ventral part is motor or efferent. Does that make sense? It's an easy mnemonic to remember how to remember which one is dorsal, which one is for which. Oh, someone is trying to join in with the drawing. Okay, so I'm gonna try to draw the spinal cord to make it easier for you guys. So we have, I'm not an artist, so hopefully this is fine. مضروب شوي يعني الspinal cord. Okay, so this side is posterior, okay, and this side is anterior, okay. What's another way to say anterior is ventral. What's another way of saying posterior is dorsal. Okay, so this is the dorsal side and this is the ventral side. Okay, so this is the gray horn. I'm going to color it or like shade it. So the reason it's called the gray horn because it has the cell bodies, and the cell bodies, they're colored gray. And this is the white, the gray matter, sorry. And this is the white matter. The reason it's called white matter is because of the myelin sheath, which is called colored white. So this contains, the white matter contains the axons, which are white, and the gray matter contains the cell bodies, which are gray. Okay, so is everything clear so far? Because we're going to take this concept a step further.
Yes.
Yes, okay, great. Horn on dorsal right. We're gonna talk about this. Just 1 second. So, sorry. I don't know what's happening with my laptop today. I'm really sorry. Okay. So, we sometimes say the term ventral horn. So this part is the ventral horn, okay? So from the ventral horn, we said this is where the cell bodies lie, okay? We will have the axons coming out, okay? And this is called what? What do you guys know what this is called? It's easy to guess. I just like...
Dorsal root.
Yep, exactly. This is the dorsal horn. I didn't hear you if you said root or horn, but I hope you did say horn, because we're going to come back to the dorsal root, okay?
I said root.
Okay. We're going to come to the dorsal root. Okay. So this will have the neurons coming out like this, okay? So what happens is, so we'll just stay here for now. So this part we refer to, this is the tree. In the tree, the first thing that comes out, or like the first thing that's down there, is the root. So this is the dorsal root. And this would just be ventral root. Why is it called dorsal and ventral? Because of the positioning. See, this is dorsal or posterior, and this is ventral or anterior. So we have the ventral horn and the dorsal horn. And we have the dorsal root and the ventral root. Is everything clear so far? Isn't the dorsal part thinner on the side? Is thinner-ish on the side? I told you I'm not an artist. This is not to be taken to real life. This is just a representative image or drawing, actually. So yeah, you'll be able to recognize with a better image. I'm just trying to explain the concept. Is the concept clear so far?
Yeah.
Okay. Perfect. Okay. So this is from the mnemonic dorsal horn. Okay. What is it going to have? Sensory or motor? Remember, dorsal, afferent. So afferent, sensory. Sensory. Okay. Now, dorsal root. What's happening? I'm really sorry. Wallah, I don't know what's happening. Okay. So dorsal root, it has only sensory. Okay, so we can say this is a sensory root. And ventral root, it has only motor, so we can say it's it's a motor root. Okay. Now the issue is we don't want to have just one fully motor, one fully sensory. So what happens in the body, subhanallah, is the motor is gonna cross and the sensory is gonna cross. Okay. And they're gonna continue together. So we're gonna have one sensory and one motor, and one sensory and one motor. Okay. So this part here will be called a ramus. And again, just according to anatomy, this will be dorsal and this will be ventral. Tamam? Now, is everything clear so far?
Yeah.
Okay. So the dorsal ramus will go on to support the back because it's in the dorsum, and the ventral ramus will go on to support the front. Okay. So before that, we have something here. Okay. Does anyone know what's this?
Ganglion, cell body.
Yes, this is the dorsal root ganglion. Okay. Now the dorsal root ganglion has the sensory cell. Okay. This is where the sensory cell lies. Okay. And it will basically extend to give out or to sense from the body, take it here and take it here to the spinal cord, where it can send the information to the brain. Okay, this is a bit advanced, but I'm trying to explain for completeness sake. Okay, the afferent pathway. Yes, perfect. طيب. So we have we have another thing to worry about. It's called dorsal root ganglion, which contains what? Sensory. Remember sensory in the dorsal root ganglion. طيب. Is everything clear so far? So if I ask you any anatomy question, now you'll be able to answer, right? Inshallah. What about the gray and white rami? I don't think you need to know that for now, for OSPE at least. You can refer to the autonomic nervous system for that lecture. But one thing, I want to know what represents the ventral root. This basically, oh my God. Okay, this is the ventral root. And I'm going to explain it on a better image, the one that's not drawing. One more thing that I want to mention, sometimes we have an extension from here and from here. This is known as the lateral gray horn. Do you guys know about this or no? Yes, yes, yes. Okay, so the lateral gray horn, just in the nutshell, we have certain levels in the spinal cords where we have sympathetic nervous system. So the lateral gray horn is where we get that sympathetic nervous system from. Okay? I don't think you need to know about this like histologically or like not histologically, anatomically. In case they ask you, remember it. Okay? Because it's part of the gray matter. It's part of the gray matter. Yes, it's part of the gray matter. So, can you guys do this? I know it's a bit long, so I will give you some time to answer this. And just to, oh, sorry, just to like make it clear, I don't know what's happening. Just to make it clear, A is pointing at this area. Don't think in the middle. And B is pointing at this area. Tamam? What's the difference between ventral ramus and ventral root? I'll go back to this after we answer that question. Is that okay? You guys, I want a full answer. I don't want just separate words. I said in the slide, I said identify A, B, C, D, E. Unless you can't identify the rest, then it's fine. Okay, perfect. Dorsal root ganglion, dorsal root. Okay. Ventral root. Okay. Perfect, 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 perfect. Okay, great. You guys identified it correctly. MashaAllah. So the way, so again, just let's orient ourselves anatomically. This is dorsal, and this is ventral. So anything on this side of the screen will be called what? Ventral. Anything on this side of the screen will be called dorsal. Anything on this side of the screen will be called ventral. So this one, ventral. And what is it? Gray matter. Okay, so ventral, gray horn. Okay, this one is dorsal. And what is it? Gray matter. So it's ventral, dorsal, gray horn. Okay, so that's the first two done. Clear? Okay, now this is what? Before the crossing, okay? Before the crossing, the first thing that comes out, we said it's called root. Now, when we put them together, dorsal plus root, it's the dorsal root. And again, this is the first thing that comes out, it's the root. So ventral plus root, it's ventral root, okay? For this one, perfect. Now, this thing that's bumpy like this is known as the dorsal root ganglion, which has the sensory neurons. Remember that? The cell bodies, yes, perfect. I don't know if you guys took this, but let me ask you, what type of neuron is in the dorsal root ganglion? You guys should have taken this. I don't know if you did though. Pseudo-unipolar, perfect. Whoever answered pseudo-unipolar, you're right. That's the answer. So, okay. So for the person who is asking, what's the difference between the ramus and the root is the first thing that comes out, which is here. This is the root. And the ramus is after they cross. Okay? And the ramus will have both sensory and motor, and the root will have either only sensory or either only motor. Does that make sense? Okay. Is everything clear so far? Could you repeat? Sure, I'll repeat. What do you want me to repeat? Ramus is after the spinal nerve. I don't think so, no. I'll check though. I think ramus is the spinal, like after it, you mean comes the spinal nerve, or after the spinal nerve comes the ramus? Because I think after the ramus comes the nerve. Is ramus mixed? Yes. The ramus will have both sensory and motor. The root will have either only sensory or either only motor. To know which one is motor, which one is sensory, in the gray horn, we use the mnemonic, same Dave. Root, then spinal nerve, then ramus. Okay. I'll make sure. Just give me a second. I'll Google it right now. I just need to move the control. Root, then spinal. Yes, okay, yeah. So you guys are correct. I got a picture just to make it clear. This is it. I'm sorry, I'll keep this for now. I'll just add it here to explain on it. Okay. So does this picture make it more clear? Okay. Hopefully I didn't confuse you guys. I tried to draw it from scratch just to make everything you guys remember, because with like drawing you guys will remember more. Is everything clear for the spinal cord and the autonomic nervous system? Hopefully yes. Okay, yes. Okay, great. Tamam. So that was the first concept. Now we're going to explain the second concept, which is the circulatory system. Now, the circulatory system, I'm not sure how much you guys have to know, but I will explain in simple details and we can build up on that. Deal? I'll just go ahead and explain. The function of the heart is to pump blood, okay? The function of the lung is to breathe oxygen and to give that oxygen to the blood, okay? So what we want is that we want to give the deoxygenated blood to the heart and send that to the lung where it can be oxygenated and bring it back into the heart. Tamam? Does that make sense so far? I don't know why it's changed slightly. Okay. Play. So first, the blood will come to the heart from the superior vena cava and the inferior vena cava. Have you guys heard about these two? Okay. So these are the major veins that bring blood to the heart. طيب. Where does it bring it? It brings it to the right atrium. تمام. Now, from the right atrium, it will go into the right ventricle. And again, we want to take that blood into the lung. Okay, so what do we do? What about the coronary sinus? We're going to come to that. I don't think you need to know that now, but we're going to go to that. Don't worry. From the right ventricle, we're going to take it through the pulmonary artery. Okay. Or the pulmonary trunk into the lungs. What is the lung going to do? It's going to add the oxygen. So it's going to add it. It's going to add the oxygen. So it's going to become oxygenated. We're going to bring it back where? In the left atrium. Left atrium, yes. Whoa, why is the labels wrong? So this should be the left atrium. And this should be the left ventricle. For some reason, it's labeled wrong. I'll just cross it out. So this is the left atrium. And this is the left ventricle. Now, the left ventricle will pump it through this artery. Does anyone know what's this artery called?
Aorta.
Aorta, perfect. Okay, so the aorta will take it into the rest of the body, where the body can use the oxygen. Once the oxygen is used, it's going to be deoxygenated. It's going to be taken into the right atrium, right ventricle to the lung, through the pulmonary artery. From the lung, it's going to go through the pulmonary vein into the left atrium, from the left atrium to the left ventricle, through the aorta, back to the body, and repeat the process. Is that clear? Would you like me to repeat it one more time so I make it clear, or is it fine? We can move on. I think I repeat it one more time just so we know the sequence of event. Okay. So we go from superior vena cava and inferior vena cava to the right atrium. I'll just write AT to the right ventricle. And then pulmonary artery to the lung. And then pulmonary vein. Then left ventricle, left atrium, sorry. Left ventricle. And then lastly, aorta to the body. Is that clear? Is the process clear? Hopefully it is for everyone. Yep, yes, yes. So the oxygenated blood, this is the oxygenated blood, right? No. So this part of the process is deoxygenated, and this part of the process is oxygenated. Okay? I'll write here deoxy. And here, oxygen. The whole reason for this process is to oxygenate the blood, is to give the oxygen. Pulmonary and systemic circulation. So this is the pulmonary and systemic circulation. Does that make sense? If it doesn't, it's okay. I can repeat one more time, no problem. Yep. Tamam. Okay, so I'm going to ask you about the lymphatic system. First of all, do you guys know what's the lymphatic, or should I explain it briefly, then we answer the question? I'll explain it after the question anyways, but do you guys want to try before or after I explain? Immune, that's one part of it. Yep. Before, perfect. Okay, tamam. So let me get a picture for you guys so I can explain on. I'm sorry, I didn't have a picture for it early. Lymphatic system. I'm sorry for the delay. Hopefully I'm not wasting a lot of your time, but trying to make it as beneficial. Okay. Tamam. So here is the lymphatic system. So the green is the lymphatic system. So what happens is we have these things are known as capillaries. Do you guys know what's a capillary? Or did you not get taught what's a capillary? Yes, okay, perfect. Now in the capillaries, some of the fluid will leak out. Okay, so it will be leaking out, leaking out, leaking out, leaking out. And obviously, we can't just leave that fluid there. The body, subhanAllah, everything is created to be perfect. It's a perfect system. So what happens is, this is where the lymphatic system will come. It will collect all that fluid that's been leaking out from the capillaries, take it, and test it. And the lymph node is like a testing area. It tests for pathogens, for foreign bodies, anything abnormal, okay? After it tests it, it will go up where it can join and go back into the circulation. So that's basically the function of the lymphatic system. It's like a clearance, so collection system. It collects the extra fluids, and then it clears it and put it back in the circulation. Does that make sense? Yes. Okay. Does it make sense to everyone or just one person? Yes. Okay. Fine. So now we need to know a couple of important things. Why does it put it back? Because this is like, let's say, what's your name? Who asked the question? Haya. Let's say, for example, Haya, every time the blood is circulating through the capillaries, you lose 200 milliliters. That's just theoretical, okay? Is it reasonable that you lose 200 milliliters every time you circulate? What's eventually going to happen? We're not going to have blood. We're not going to have volume, right? So the way we do this is that the lymphatic will collect it. So every time you lose 200 from the capillaries, you gain them here, the 200 back. Does that make sense? Okay, perfect. Tamam. So there are multiple things we need to know for the lymphatic system. So we have a good orientation of what's happening, okay? Whoa. So a lymph node is basically here. And it's basically, again, it's a place where like things will be filtered. It's where we have the lymphocytes to identify any bacteria, any infection, any pathogen, okay? So we're going to have this part entering, okay? And this part leaving, okay? Part entering is called afferent, and the part leaving is called efferent. Because efferent is like taking away, afferent is taking into, okay? Tamam? So what's going to happen is that we're going to collect lymphatic from multiple parts of the body, and then we're going to have two important structure. The first important structure is the left. Does anyone know it? Like two important lymphatic structures that you need to remember. Try to take a guess. It's fine, even if you get it wrong. Thoracic duct, yes. Inguinal, no. Okay, so we have two important ones. Inguinal is one of the lymph nodes. Yes, you're right, but it's not the main one. Okay, we have the thoracic. Sorry, there's no left. Thoracic. And we have what? We have the right lymphatic duct. Why are these two important? These two are important because they take all the fluid or the lymphatic fluid from the body and put it back here. Okay? So these are the ones that collect from the whole body. Remember these two. It's important. Thoracic duct and the right lymphatic duct. Right lymphatic duct, thoracic duct. Perfect. Okay. Who apologized? Don't never apologize for a wrong answer. It's fine. You can always answer. Okay. So the place where they put it back, does anyone know where the place is?
Superior vena cava.
Close. It's a specific area. It's at the junction of two vessels. Does anyone know? the junction of brachiocephalic, what am I even writing? Cephalic, and internal jugular. Jugular. Maybe you guys have been taught this, maybe not. I'm not sure if okay, do we need to know this? Okay. The fact that you're asking me, do we need to know this? Probably you didn't take it. I'm just saying it for the sake of completeness, just so you know. You don't need to know it. Yeah, I'm just explaining where. المهم, this is where it comes back and goes back into the venous system, where it will go back into the heart, and then from the right atrium to the right ventricle, from the right ventricle through the pulmonary arteries into the lung, from the lung through the pulmonary vein into the left atrium, left ventricle, aorta, back into the body. I keep repeating the process just so you guys never forget. Okay? Is everything clear so far? Forget about the junction, whatever. Forget about this. Forget
I
about
want to
this.
ask a question.
Yep, sure, go ahead.
Yes. The movement of lymph into the back into the blood vessel, is it through HEV?
HE. What does that stand for? Do you know?
Yes, highly epithelial venules.
صراحة, I'm not sure of what that stands for or what it means, يعني. Maybe it is. Like, I don't remember all the specific details. But if that's what's said in the lecture, then probably is the answer. But I'm just giving the concept of the lymphatic system, not the specific, because I don't remember the specific. I can't lie to you and say, yes, I know this. Do you want me to Google it and get back to you, like after the session? Or the people in the chat can answer. Do you guys know the answer? Is what she said correct? What lecture is this in? I'm not sure. Lymphatic system. Well, I know that HEV is in the lymph node. I can check this out later and get back to you guys, but I don't think you need to know this. Like for the OSPE at least, I'm like 99% sure you guys don't need to know this. Ya Rabbi, you don't need to know this. You guys have enough stuff to know already.
For the HE one, it's in the lymphatic system, but I don't think it's for OSPE. It's for the final exam.
Okay, maybe for the final, yeah.
Yeah, in the slides it says lymph nodes. Lymphocytes conveyed in the blood enter the node through the walls of post-capillary venules, which is the HEV.
Okay. I guess so, yeah. Post-capillary venules, yeah. I'll get back to this later. But I don't want to confuse the crowd right now, and we're just sticking with the basics, if that's okay. So is it okay to move on now? I think Malik asked. Is it okay, Malik? Whoa. Okay. طيب. Can you guys answer this question? Now, I put this question not knowing that it's not important to know this. So just answer the bonus. Forget about the question. Just give me a second to scratch it out. Forget about this. Just answer this. Thoracic duct, right lymphatic. Okay, yes. So there are two, thoracic duct and right lymphatic. Yes, that's all you need to know. And there's this statement that was highlighted in your lab folder in yellow. I put it there. I'm not sure if you need to know it. You will take this in GIT. That's why I don't know if you need to know it now or not, but I don't think so. I put it there in case. So we can move on. We need to, where does the brachiocephalic drain? So Dr. Atif stressed on it, then it's important. Okay. So Sister Kylie, I don't know, whatever this says. It's it marks the beginning of the thoracic duct. Just know that fact. I don't know how they'll ask about it. They're probably going to ask you what's the beginning of the thoracic duct, which is Sister Kylie. Okay. طيب. Is there anything not clear about the circulatory system that I can explain? I have your lab folder. I can explain on it certain things if you guys have it unclear. Is everything clear? Is it not clear? Do we have mixed answers? Clear, clear. Could you explain the lymphatic? Sure. What exactly do you want me to explain the lymphatics? Is there something specifically not clear, or just the whole concept again? Well, I'll just explain the concept. So, in the capillaries, we have loss of fluid, okay? The fluid is getting out. Now, this fluid, we can't just leave it here. Something has to take it back. It's taken back by the lymphatic system, okay? So it goes back through the lymphatic system. It goes from here, from the afferent vessel, sorry, and then goes to the lymph node, where it's screened to check if there is any bacteria or anything that's bad, to basically filter that fluid, okay? And then it will go through the efferent vessel, and then from the efferent vessel, it will go to one of two places, either the thoracic duct on the left, or right lymphatic duct on the right. Okay, and then go through the vein back into the right atrium. Is that clear? Perfect. Okay. Tamam. So this one is pretty important, the joints. It's really important. It's going to be helpful also for you guys in MSK. So try to focus with me. I'm going to make it as simple as possible, hopefully. And inshallah, yani we'll get out of this lecture remembering all types of joints, inshallah, and able to answer all types of joints. Okay, so my laptop just going crazy, normal. Okay, so again, we have three types of joints. Okay, we have fibrous, cartilaginous, and synovial. Okay, now fibrous is like the one that doesn't move at all. Okay, does not move. Cartilage also doesn't move, but allows for minimal movement. And synovial is the one that allows for movement. Okay, so that's the first thing we need to know. Tamam? So we're going to start by talking about the fibrous joints. Tamam. So under fibrous itself, so let's go back here. So fibrous has three different types. So we have something called Sindus sutures, first of all. Okay. And I don't know if you guys heard about the skull sutures. Okay, synarthrosis and diarthrosis are. Wait, oh my God, we just start this after lymphatic. I'm sorry. I'm confused. Synarthrosis, diarthrosis, and what? Okay, so here it is. Okay. So the fibrous has 3 different types. We have the sutures. I think you guys heard about the sutures that are in the skull. Okay. And these basically sutures in the skull are a fibrous type of joint. Why is it important to be fibrous? Because we don't want the brain to go out of the skull, and simply, it makes sense, I guess. And then we have the gum foci. Do you guys know what are the gums? Have you heard of the gums? Yeah. The gums are these the ones above the teeth. So gum foci, it's easy to relate it to the teeth. So the example for it is the teeth. So this is another type of fibrous joint. Okay. And then we have syndesmosis, which is this one. Between the between the ulna and the radius. Or sorry, between the tibia and the fibula. Okay, also between the radii and the ulna, but in this picture is the tibia and the fibula. Okay, so what you need to know from the fibrous, there are 3 types. Sutures, which are the skull, gum foci, which are in the teeth, syndesmosis, which is in the radio-ulnar joint or the tibiofibular joint. Okay, tamam? Area around the teeth. Okay. You have to say medial radio-ulnar. I get what you mean, because there's also another synovial joint in the radio-ulnar joint, but we're going to get to that. And that will be proximal or distal. So our gums are bones? No. I'm just saying to remember that the teeth are gum foci, like type of joint. Remember that the teeth are related to the gums. It's just to make it easier for you guys to remember. Okay. So these are the 3 different types: sutures, skull; gum foci, teeth; syndesmosis, either radio-ulnar or tibiofibular. Okay. And whenever in joints, ever we mention 2 types, 2 names, like this, for example, radio-ulnar, it's an articulation between the radius and the ulna. Simply, tibiofibular between the tibia and the fibula. Okay. Does that make sense? Hopefully it does. Hopefully. Tamam. Now, the second type of joints is the cartilaginous. Tamam. So we have the primary or the hyaline cartilage, and we have the secondary or the fibrous cartilage. Now, the way people remember which one is which, okay? Secondary is in the middle, usually located in the middle. Okay, so either in the vertebra or the pubic symphysis, which both are in the middle. Okay, so secondary is in the midline. And the primary is to the sides. So in the epiphysis or the diaphysis, which are in the arms, and the legs, which are on the sides. Okay, that's how the people easily remember it. So secondary is in the midline, which is an example for pubic symphysis, this one, or vertebral disc. Do you guys know the disc between the vertebra? This is a type of secondary cartilaginous joint. Okay, and the primary, we have synchondrosis, that's the name of it. We have the diaphysis and the epiphysis. And this is the epiphyseal plate, which is basically a type of cartilaginous joint. So this is how you basically remember it, and this is what you should know from the cartilaginous joints. Tamam? If they ask you what's an example of a primary, if they give you, for example, the pubic symphysis, and they ask you what type of joint is this, don't answer it's cartilaginous. Answer it's a secondary cartilaginous or fibrous cartilaginous. Never answer cartilaginous only, because I know you guys know the answer, but sometimes you will forget to add secondary or primary, and it's important to add it because they will mark you down if you don't add it. Okay. تمام. Can we write Eileen? No. Just write everything. Like if you know it, write more. Never write less. And you're just setting yourself up to lose marks if you don't write the whole thing. Sometimes you can be stressed and you can you're not going to lose the whole mark. They might like just mark you a little bit down. They might give you the full mark. But I'm saying just to be safe, on the safer side, write the whole thing, okay? Even sometimes you'll be stressed and you'll forget. It's fine. Don't feel bad about it. I'm just telling you from now, in case you get to that situation, please write it fully. I had situations where I didn't write it fully and I lost a mark. It's fine. It's not the end of the world. It's fine. Fine. Moving on, we have the third type of joints, the synovial joints. Now, the synovial joint is like the most important joint. It has so many types. All of them are important joints, of course, but this one is like the one with the most types. They're 100% going to ask you about it, okay? So the synovial joints are basically called synovial because they have a synovial cavity. Okay, what's the cavity? It's basically something. So this basically usually would be like this. It's a cavity that would contain this joint, okay, and would have synovial fluid. It's not firmly stuck together. It allows for movement, you know? Yes, it has synovial fluid. Tamam. So now we have different types of joints, okay, in the body for synovial joints. So we're gonna start one by one. Oh, why is the laptop resisting? Okay, we're gonna start with the pivot joint. Now, pivot joints is the one that allows for pivotal movement. Now, for those who are not really good at physics, what pivotal movement is like this: to say no, okay? This type of movement is pivotal, okay? So saying no is done by this joint. The joint between C1 and C2 vertebra. Okay, this is a type of pivotal joint. Now we have also the hinge joint. Okay, now what's the opposite of saying no is saying yes, which is what you're doing this. This is a type of hinge joint. Okay, so saying no is pivotal, saying yes is hinge. What other hinge joint? We have the elbow flexion and extension, the knee extension and flexion. You guys know what's flexion and extension, right? Okay. So these are the first two types of joints. So if they ask you, for example, what type of joint is present in the elbow, or like what type of joint allows for extension and flexion, it's what? It's the hinge joint. Tamam? Then we have the saddle joint. Now the saddle joint is present in a specific place, okay? What's this place? It's the thumb. Now, if you guys try to move your thumbs around, you will feel like, okay, you have a lot of range of motion. Do I look stupid? Let me see. There is some range of motion, but it's not so flexible. You can't like, it's not the same as like, for example, moving your shoulder. You know, there is a little bit of restriction in that movement. Okay, so if you want to think about the saddle joint, saddle joint, think of the thumb. Okay. Yes, is that yes for me looking stupid or yes for understanding? Hopefully for understanding. Okay. So we also have the ball and socket joint, both. Allah يسلمك حبيبي, thank you. So ball and socket joint is simply a ball in a socket, okay? And it allows, this type of joint allows for the most range of motion, okay? And you guys can try this out for yourself. You can adduct, abduct, extend, flex. You can do so many things with your shoulder and with your hip. You can't do that with every joint, okay? So that's ball and socket joint, okay? And then we have condyloid. Condyloid joint is also similar to ball and socket. However, Look how much I can move my wrist up and down, or actually down, but I can't move them up all the way because it's restricted. Same for the sides, you know? This is why condyloid is different from, what's it called? From the ball and socket. So an example for condyloid is the wrist. Think of the wrist, okay? طيب. What's the last joint that we have is the plane joint. And the plane joint usually is in the small bones of the hand, which are known as the carpals, or the small bones of the legs, which is known as the tarsals. How is it different from the saddle? Okay. Now, the difference, I can't explain it to you theoretically, but the difference between them is in the motion that each one provides. When you are sitting on a saddle, okay, you have a certain type of movement you can do that you can't do with a condyloid, okay? So just the type of movement is different, okay? The range of motion is different. But both of them allows for more movement, for example, than hinge joint or pivot joint, okay? Now, the way they could ask you about this is they could show you, they could literally like show you this picture. Sorry. They could show you this picture and be like, what type of joint is this? And give me an example for it. Tamam? So what would be the answer? The answer would be hinge. An example for it is the elbow. Hello? So that's for the hinge joint, okay? Now, let's say, for example, they ask you, what was it? They can ask you, give me what type of joint allows for multi-axial movements. Okay? And give me an example for it, okay? Ball and socket, yes, yes. So the answer is ball and socket. And an example for it is the shoulder, for example. Okay, so these are the type of joints. And here I put for you like the different. Okay, so someone is saying multi and bi, they're confusing. Okay, so multi means more always. When they say multi, it means more than 2. Okay, or more than like 3 and more. Okay, and what else? We have bi. Bi is 2. If you guys excuse me for a second, my leg is cramming. I'm sorry. This is a type of protocol because I'm sitting on the ground, so I just have to move around for a bit. I feel like everything is okay.
Let that synovial fluid be flowing.
Yes. Okay. So, since you guys brought it up, I'm gonna explain it. The uniaxial, biaxial, and multiaxial. So, uni means what? 1. Bi, 2. Multi, 3 plus. Okay. Which one allows for one movement? Hinge. Okay. Is it hinge? Wait, let me make sure of this. For those who are like correct me if I'm wrong. Yeah, I think it's bi. I got it wrong, I think. Just let me make sure. Example for yeah, it's correct. It's correct. Okay. That's why it's confusing, and I get you. Whoever answered, now I get you. Okay. So it does do 2 movements, but when we say uniaxial, it's acting on one axis. So when we have the elbow, okay, so this is like, let's say this is the hinge joint. We're acting on one axis only, which is either moving this way or this way. But at the end of the day, it's just one axis, okay? We can't move this way or that way. Tamam? This is why it's called uniaxial. Now, biaxial, for example, saddle, I think saddle is a biaxial. I'm not sure, but I think it's biaxial. Let me make sure. I don't want to give you wrong information. And this just came up in my head. I should have probably Googled it before. Yes, it's biaxial. So you can move your thumb forward, backward, to the sides. Okay, so this is one axis and this is the other axis. Okay. Now multi-axial means you can move it in every single direction you can think of. And that's obviously in ball and socket. Okay, does that make sense? Is it clear in your head now, like how it works? It's the same as saddle? No. Unless you have like a really, I don't know, flexible thumb. I don't know. It's not the same as the saddle. The shoulder has way more movement. Plane, non-axial, okay. Thank you so much, whoever wrote this. And yes, you made it easier. Actually, I'll copy it. Take your work. Make it mine. I'm kidding. I'll just put it here. Oh. In case you guys want to revise from these slides later on. Later on as in like within the 2 days that you have. Okay. Thank you, Sarah. Tamam. We can move on, right? Okay, let's start answering questions. And we're gonna have a break after this concept, I think. Yep, okay. Look, you guys are answering correct, but I hate to break it to you. They may not accept this question, like this answer. If they're being really like, I don't know what's the word, meticulous about it, you have to say synovial, ball and socket. Synovial, ball and socket. Okay? Okay. Now, I'm being too strict with you guys, so you get it wrong now, not later, not after tomorrow. Okay? And I'm sure you guys will do great, inshallah. So, okay, and you don't stress out. Inshallah, they will accept both answers, but I'm just training you guys so that you start writing the full answer. After tomorrow is hell. We'll talk about that in a bit. Don't jump over the events. Tamam. So everyone got it. Should we move on to the next question? Yeah. What type of joint is this? Again, be specific. Oh, so I wonder why you guys are saying it's cartilaginous secondary, fibrous, or secondary. So whoever said it's fibrous syndesmoses, you are correct. For those who are saying secondary cartilaginous, I wonder why. It's fine. It's fine to make mistakes. Just explain to me why. Because I gave you the mnemonic specifically for secondary fibrous or secondary cartilaginous, and I said it's in the midline. Are the legs in the midline? Nope. I would have been less sad if you answered primary cartilaginous, which is still wrong, but you get the point. So I'll re-explain this. Introseous membrane, yes, introseous. That's what it's called, but you just have to know the type of the joint. So here it is again, syndesmosis, radial. I put the same exact picture. And so for cartilaginous, remember the secondary fibrous is the symphysis, either pubic symphysis or vertebral disc. Okay, and for primary, it's either diaphysis or epiphysis. These are all the cartilaginous joints you need to know. Okay. It's fine if you mix up. It's fine. Just try to orient yourself so that what's it called? You don't mix up later on. Is the joint, rib joint, primary? I don't think you need to know about that. Unless it's mentioned, yeah. Okay, so this is a bit difficult, or actually maybe too difficult, but if you can answer this, خلاص, and inshallah you can answer everything. If you can't answer this, inshallah you will answer everything anyways. Always be specific. أرجوكم, please, the full answer. So I'm saying correct answers, but it's not the full answer. Condylus synovial, yes, perfect. Whoever said hinge, no. Why? Because I'm pointing at this part. Okay, so can you see my camera? Can you see me? Tell me yes if you can see me, because I don't want someone to walk on the room while I'm doing this. Okay, so your fingers, look, you can move them down and up, and you can move them to the side and in a circular motion. So this is a condyloid type of joint. This part of the finger, you can only bend up and down, okay? This is a hinge joint. They will not ask you about this part, they will ask you about this part. Does that make sense? You probably confuse this part with this part. Whoever answered, okay, yeah, okay. It's fine to confuse as long as you get it now. Okay, metacarbophalangeal, yep. Perfect. I kept the name on purpose just in case you guys forgot where the location is. Because you don't need to know the location from now, it's fine. Yes, very specific. I'm proud of you. Okay, but you don't need to read the whole thing. It's fine. Just synovial condyloid is enough. Unless they ask you to name the joint. That's something else. But we're going to take a 5 minutes break here. Do I make it 10 or 5? It's up to you guys. 10. Whoa. Okay. I'll make it 10. It's fine. 30. Oh my God. Before you guys go, is it clear? Am I explaining clearly so far? Or is it a bit, yani, it's fine. You can be honest with me. Okay, alhamdulillah. Best teacher, no, thank you. It's fine. Listen, inshallah, we'll get, inshallah, once we finish with the whole lecture, inshallah, you guys will be amazing with OSPE. Not that you already not, but any better, inshallah. Okay, we'll come back in 10 minutes. I'll stay here. I'll be here for the 10 minutes. Ayman, you can pause the recording. I will be taking questions and chatting with you guys for the meanwhile.
Okay. I'll pause the recording. The meeting will keep going on. 10
Sure.
minutes, yeah?
Yep. So 8:40 we'll start again.
Okay.
So, have you guys taken the types of epithelium? Yes or no? Yes, yes, yes. Okay. So simply, there are multiple. Oh, it says connection unstable. Am I lagging to you guys? No? Okay, perfect. So we have 1, 2, 3, 4, 5, 6. Okay, we have 6 types of epithelium. We have simple, first of all, and we have stratified. So simple means there's only one layer, okay? One layer. Stratified, it means 2 or more layers. Tamam? So this is, first of all, the first classification. Then, based on how the cells look like, we can make them into different categories. We can call them squamous because they're squished. Okay, look how squished they are. This is squamous epithelium. Or cuboid because they look like cubes. Or columnar, which is basically tall column. Okay, tall columns. And again, simple. Never just say squamous, never just say simple. Say simple squamous epithelium, simple cuboidal epithelium, or simple columnar epithelium. And now we know the difference of how each one looks. Then we have stratified. Now for stratified, we look at the top layer. Okay, yeah, there is not many types to care about the top layer, but remember for squamous, you might think, oh, it's cuboidal here. Why is it called squamous or stratified squamous? Because we look at the top layer. So the top layer is squamous. So this is stratified squamous epithelium. Okay. And here, this is called a transitional epithelium. So transitional epithelium is a special type of epithelium. Why? It's called transitional because it transitions from 2 to 3 layers into like 5 or 6 layers. Because it needs to accommodate for the urine, okay? It needs to expand and go back into its normal size. In the urinary bladder, for example, we accumulate urine, okay, accommodate for urine, and go back. That's why it's transitional, okay? Okay, it lagged. Okay. طيب. Where did it lag? Exactly, so I repeat. Tell me where to repeat from. Which point? Transitional? Is it transitional or the one before? Transitional, okay. طيب. So transitional epithelium, what it does, it transitions, okay, into different layers. It can be 2 to 3 layers, and then it changes to 5 and 6. Why? Because it wants to accommodate, okay? It wants to be expandable. Accommodate for the urine in the urinary bladder, for example. The urine will keep filling, it will need to expand. If it's just strictly squamous epithelium, it cannot expand. Can you expand your hand if you want to? You can't do that, okay? Yes, distension. And then you have something called pseudo-stratified. Now, what does pseudo word mean? It means like falsely. Okay, yeah. So falsely stratified, it means it looks like it's in layers, but really they're all in one layer. Look, all the cells are touching the base, so they're in one layer. Pseudo-stratified columnar, so the cells are columns or columnar, and they're pseudo-stratified. They look in multiple layers, but they're actually in one layer. Okay, so these are the 6 types of epithelium. Is it clear so far? Can we say the location for each one? Yes, I'll tell you the location for each one. Once we go through that, we're gonna go through questions, and if I didn't cover them by then, remind me, and I'll give you the location for each one. Okay. I just want to drink water. Okay. So, which of the following represents pseudo-stratified epithelium? Notice, first of all, we have 4 letters, so you just have to choose one of them, and it's asking about pseudo-stratified epithelium. A, C. Okay. طيب. Whoever answered A, you are correct. Whoever answered C, you're not correct, but I would understand why you answer C because it looks really similar. صح? It looks really close to each other. Okay. Now, this one in C, you would see that all the nuclei are on one line. In A, you would see like one here, one here, one here, one here, one here. So this is more pseudostratified. Maybe this one not perfectly all aligned, but they're almost perfect, okay? And in histology, I would say the most important thing is to not understand as much as it's to memorize, okay, the look. Because you might understand, oh, okay, this is like squamous epithelium, all of that, okay? But you'll have to visually memorize it, to recognize it, you know? So this one, A, is pseudostratified, okay? Can someone tell me what's C? Simple columnar. Again, don't just say columnar. That's not an answer. They wouldn't accept it. Don't say columnar. Say simple columnar. And in this one, we have special thing. It says connection unstable. Is it lagging? Okay. Am I back? Is it still lagging? Am I lagging? It's not lagging. Okay, perfect. So, so can you see these things on the edges? Am I zoomed in your screen too, just to know? Okay. Can you see these like things coming off the epithelium? Do you guys know what they're called? Like here, 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 here. Yeah, what they're called? Cilia. Cilia or microvilli. Perfect. So it could be cilia or microvilli. Cilia in the lungs or respiratory system, and microvilli in the gastrointestinal system. Okay. So since this one, pseudostratified epithelium, where do we find pseudostratified epithelium?
Trachea.
Does anyone? Trachea. So in the respiratory system, so this is cilia. This part here is cilia. Hello? And this is found where? In the respiratory system. Right. Now I'm going to go through one by one, just to make sure every picture is clear. So this one is simple columnar epithelium with microvilli. Okay. So where do we find this? Gastrointestinal system. So if they say like duodenum, the stomach, not the stomach, sorry, duodenum, like small or large intestine, basically. So I'll just write gastrointestinal. And these small things that are coming off are what? They are microvilli. تمام. طيب. Wait, let me move the camera away. Okay. So, what type of epithelium is this? Weird. That's not an answer. Simple squamous, transitional, simple. Okay, so see, this is what I mean exactly by you cannot understand histology only. You have to be able to recognize this. You have to memorize it. Okay, so this type of epithelium is simple squamous epithelium. This is the one layer. Okay, so this is simple squamous epithelium. Where do we find it? Looks stratified for me at least. Okay, so I get you guys. This is a bit of a difficult image. I know you're expecting to see like literally like just one line like this, right? But that's not the case in histology. It's gonna look weird. Do we need to know their location? I'm not sure if they ask you, but it's better to know. Okay, and where do you find simple squamous epithelium? You find it in the blood vessels. Okay. Skin is stratified squamous epithelium. It's different. Alveoli or linings. Perfect. Whoever answered this question answer is correct. Okay. طيب. What's the type of epithelium in picture D? Yes, it allows for diffusion. Simple cuboid, nope. Transitional, yes, it's transitional. And where do we find it? In the urinary system. Okay. طيب. Now I'll go do something real quick on your, I'll just pull out your slides. Keep. You guys can't see my screen, right? My slides only, right? Okay, I'll share my screen. That's better. Can you see well now? These are the slides you guys have, right? We're gonna go through them together. Okay, perfect. We're gonna go through them together, just so that we go through all the types of epithelium. So this one, so the way they show you is that they show you first like the bigger picture, and then they zoom in. So this one is the bigger picture from this one. Okay. Maybe that's why it's confusing, because if you look at it, it's actually a lining of an artery, which makes sense to be lined by simple squamous epithelium. Okay. So this is a simple squamous epithelium. We just talked about it. Okay. Now, if you go into the lower duodenum or the small intestine, okay, there is like these glands, they are cuboidal. Now, I want you guys to look here. See how these are more cuboids? Let me draw on this. Okay. Can you see how these are more of cuboids than the simple squamous? Whoever thought it was like simple squamous was cuboid, this is what cuboid usually looks like. Yes, for secretions and absorption. Yes. Okay. So next one is this one in the duodenum. Okay. Now it's not the glands, it's the epithelium. And remember, the epithelium in the gastrointestinal usually has microvilli. So here is the epithelium. Again, here is the epithelium. So these cells, they look like columns, okay? And they have the microvilli. So what do you call this type of epithelium?
Simple columnar.
Simple columnar epithelium with microvilli. Hello? And these are the microvilli they're pointed at. Can you hear me? Am I lagging? Okay. So, simple columnar epithelium with microvilli. Okay. طيب. Then we have the stratified squamous epithelium. Now, the stratified squamous epithelium, where do you find it? We find it on the skin. طيب. Why do we need stratified squamous epithelium? It's like a protection. okay, to not allow things in. That's why it's stratified. طيب. So what we can see is multiple layers of epithelium, and the top one is made from squamous epithelium. تمام? I'm just trying to go with you for the pictures to make sure you guys understand. Now, this is also stratified squamous epithelium, but it has keratin. This material is keratin. Also here, this thing is keratin. They might ask you, what is this? And the answer is keratin. تمام? And this is the one we explained before, pseudostratified. And lastly, the transitional we also explained. I'm just making sure we went through every single type you guys took. طيب. I would urge you guys to look at these pictures as much as you can. don't خلاص leave all your studies and stuff, but go through them multiple times. I put these slides in a question format. Why? عشان when you go after this session, you want to revise, for example, for OSPE, you'll go through this slide. You don't know the answer, okay? Once you check the notes, you will see the answer. Hello? So this is a way of revising, basically. Should I move on? Is that good? Okay. طيب. Can someone answer now, since we already went through this? Okay, simple squamous. Okay, perfect. طيب, what about this question? Don't mention that. I didn't ask in the question where is the location, but if they ask you, you do. But I don't think they're gonna ask. Inshallah, they won't. Simple columnar with microvilli, simple columnar. See, we just went through this concept in 5 minutes, and you guys already remember the answers, mashallah. Imagine if you revise this like once or twice, خلاص, you're gonna be good. Inshallah, you'll get the answers على طول. Okay? You feel a little bit more confident in your histology abilities, or لسه في شك? $50-50. Okay, so the thing I would tell you to do is go through the slides, not necessarily mine, also the doctor's slides, to memorize how the images look like. Yeah, I'm sorry for speaking in English. In Arabic, في شك means in doubt. Yes, in doubt. طيب. So what type of epithelium is this?
Transitional epithelium.
Transitional epithelium. Where do we find it?
Urinary bladder.
Okay, perfect. تمام. And okay, so do you guys want me to go through the connective tissues first? Are the pictures on OSPE the same from the slides? Sometimes yes, sometimes no. But you will be able to recognize it. Don't worry about it. It will be very, very obvious. Don't worry, don't stress out. It's fine. I'm sure, and if you went through the pictures once or twice and you were able to answer, you will be able to answer. Okay. So it says your connection is unstable. Is it still stable, unstable? I hope I'm not lagging. Okay, someone asked, is this stratified squamous epithelium on top? Yes, but that's not the question. But yes, you're right. That's stratified squamous epithelium. طيب. Do you want me to do the types of connective tissues before answering? Or do you want to answer? And as we answer, I explain. As we answer. Okay. طيب. So people are answering and they said this is loose connective tissue. Okay. So in the skin, we have multiple things. So we have the epithelium, This is the first thing. Then we have the loose connective tissue. Tamam? So this is the epithelium. The second thing we have is what? The loose connective tissue. Below it, we're going to have the dense connective tissue. Okay? And I think we can see it. Oh my God, let me move this. Yes, so here is the loose connective tissue. Okay? And this is the dense connective tissue. Can you guys see this? Whoever is asking about mucosal, I think it's easy to confuse between them, but look at this one. It's just like lines, purple lines, and nucleus. There's no epithelium in this one. So it's easy to remember this, is that you have to, like, first of all, know that it's coming from the umbilical cord, okay? And they're probably going to give you this image, with it. They're not just going to give you this image. Once you see that this image is with it, you're going to recognize that this is, okay, this is a mucus connective tissue, mucus embryonic connective tissue, okay? If they give you only this, it will be hard to recognize, but inshallah you will. Okay, I'm lagging, I'm sorry. Am I still lagging?
No.
Okay, okay, tamam. So this is the mucus, and since we went through them, might as well just go through the other one. Okay, this is the mesenchymal embryonic connective tissue. It is usually found in the nasal cavity of the what's it called, the mouse. Okay, this one is found in the umbilical cord. Okay, so if you see the section like this, okay, in the exam, this is what mesenchymal embryonic connective tissue. If you see a section like this showing the umbilical cord, it's probably mucous embryonic connective tissue. Hello. Now, again, epithelium. Let me go back to the slides. We start with epithelium. This is in the skin. Then we have loose connective tissue, and then below it we have the dense connective tissue. Okay. Now, what other connective tissue do we have? This is also loose connective tissue, and you can see that it's loose, okay? But this is a different staining, okay? Just memorize this picture in case they bring it to you, to know that, to recognize that this is loose connective tissue. This one is the same image, but from the lower layer, from the dense connective tissue area. And this is another example of this dense connective tissue, but with a different staining. You can see that it's really dense. You can tell from the image that it's really dense. Hello? Now, two more things to keep in mind. I didn't put questions about these, I think, or I put question about one of these. So I'm just going to explain them well in case we don't go through them in my slides. We have to know that in the lymph nodes, we're going to have reticular fibers. These are the ones, wait, I want to get the drawing thing. These fibers, the ones that look like this, are reticular fibers or reticular fibers, okay? And these are usually found in the lymph node. They hold the lymph node together. They hold the cells together. It's like the meshwork that holds the cell from falling, because otherwise we can't just have cells, We have something to hold them. The reticular fibers in the lymph node, okay? So this is for a reticular fiber, okay? This one done. Now, and then we have what? We have the elastic fiber. Elastic fiber, it's really important. From the name, it's elastic. It allows for the artery to expand and go back to its original size, okay? And this is found where? In the aorta. Do you guys want to just memorize that it's found in the aorta, or should I explain why is it found there? Memorize? Okay, we'll just memorize why it's there. Okay, so it's found in the aorta, elastic. Elastic fibers found in the aorta, and this is how they look like. You have to know how they look like. I can't explain how they look like. I'm trying to go with you through them so that in case you remember from me saying it, okay? And lastly, we have the adipocytes, okay, or the adipose tissue. The adipose tissue is the easiest thing to recognize. It looks like this. It looks like a I don't know the term in English. خلية نحل. Whoever knows the term in English, please type it in the chat. Beehive, that's the one. Yeah, it looks like a beehive. Hello, that's all for connective tissue. So to revise them quickly with you guys, from the umbilical cord, we have the mucous embryonic connective tissue. This is how it looks like. And then from the nasal cavity of the mouse, we're going to have also embryonic mesenchymal connective tissue. And then we're going to have loose connective tissue, dense connective tissue. This is again loose connective tissue. And this is dense connective tissue. Lastly, we have the reticular fibers. And we have elastic fibers. Is it clear so far? Can we go back to the slides? Clear. So, what's the answer for this? Everyone should be able to answer this if you're focusing with me. Dense, 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 regular, dense, 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 dense. Okay, perfect, perfect. Dense, regular. Perfect. Everyone is answering it correctly. Just let me check something. So you guys are mentioning irregular. Since you brought it up, where do you find dense irregular connective tissue?
Tendon.
Irregular, not regular.
Skin.
Yes. Wait. My laptop is just going crazy for a second. Sorry for the delay. So in the tendon, it's regular, and in the skin, it's irregular. Okay, sorry, I'm back. Where's the slides? Clear? Okay. طيب, what is this? Reticular. Yes, that's the answer. See, you guys, just once you go through it, you'll easily recognize it. Hello? طيب. Now, before we answer this, I want to explain this. طيب. Now, we finished connective tissue. If they ask us to mention two structures for what? Dense irregular or dense regular? They're not going to ask you two structures for dense irregular, I think. They're going to ask you maybe for reticular. I know for reticular there's lymph nodes. I don't think they're going to ask you to mention two structures. Yeah, so if they ask you where's reticular, you answer it's in lymph nodes. If they ask you where's the elastic, you answer is in elastic vessels or aorta. Okay, so it was a mock, right? What was the answer? They probably gave you an answer key, right? I forgot. Okay. I'm not sure, honestly, of two types. I just know that there is lymph nodes. Trying to remember, but I can't. Sorry? I'll check it later and get back to you guys. Is that fine? Just so we save time for the others. Okay. So we have three different types of muscles. Okay. We have smooth muscles, skeletal muscles, and cardiac muscle. Histologically, the difference between them is that we'll start with the cardiac. The cardiac is going to have one nucleus, and it's going to have something that's called the intercalated disc. Okay? Also, it's striated. You'll be able to see the striations. The striation means this, basically, the lines. Hello? And the nucleus is placed in the center. Yes, thymus also has reticular fibers. Yes, I think. But I'm not sure if that's an example they gave you or not. Okay, so the way to recognize the cardiac muscle, number one, it will have one nucleus. Number two, I'll write it, one nucleus. Number two, it will have intercalated disc. Number three, it will be striated and branching. Okay, now smooth muscle cell will have also one nucleus. However, it will be smooth. That's why it's called smooth muscles. It will not have striations. Okay? Now for skeletal muscle, it's going to have multinucleation. And it's going to have what? Striation. So one more time, skeletal muscle, we're going to have multiple nucleus and striation. Here you can see it. Cardiac muscle, we're going to have one nucleus, intercalated disc, and striation. And smooth muscle, we're going to have one nucleus and no striation. Hello? طيب. What is this image showing? And what's structure A? Okay, and what's structure A?
It's the discs.
Intercalated disc, yes. Okay. So is it clear? Do you want me to go through the images in your slides, or is it okay? I think if you go in with these rules in mind, you'll be able to recognize. Okay, it's okay. تمام. طيب. Oh, okay. Now for the neurons. Okay. So for the neurons, we have multiple types of neurons. You guys know this, right? You were taught this. So I'm going to go through them again. So we have the multipolar neuron. Okay. We have the bipolar neuron, the pseudo-unipolar neuron, and unipolar neuron. Again, we have to understand the word, not just memorize it. Multipolar, it has multiple, what? It has multiple processes coming out of it. Okay?
Okay.
Yep. So this is why it's called multi-neuron. Bipolar, it will have two. One, two. Pseudo-unipolar, it has one, but really it's dividing into two. So it's like falsely one. Okay? Where do you find this? Do you guys remember?
General sensory.
Yes, dorsal root ganglion. Okay. And then we have unipolar. It has only one pole coming out of it, or one process coming out of it. Okay? Are the types clear? Okay. So, which of the following is a unipolar neuron? Are you guys there? Okay. So, the answer is C. Okay. And I understand this is a bit difficult. Yani it's honestly, I wouldn't be able to recognize this if I didn't memorize the pictures. So I put this slide here. Yeah, it says multipolar neuron in both A and B. So it's C, okay? And honestly, like I could be here like explaining to you and I'll be like, oh my God, it's because it looks this way or that way. And I understand that all of what we see is literally like pink and purple and it's like just colors. I don't know what I'm looking at. I'm fourth year and I don't know what I'm looking at. So my advice to you guys is do this. Wait, let me share my screen. You go here, you go through, you go here and you do this. You look through these pictures because these are what's most likely to come, okay? So this is a multipolar neuron, for example. It might come. So once it comes in the exam, you have to know this is a multipolar neuron. Same thing here. This is a multipolar neuron. See, I'm getting the same exact pictures from the exam. Not from the exam, from the slides. Okay? This is also a multipolar neuron. Just recognize it. Tamam? Now this one is a bipolar neuron. This is like so likely to come in the exam. It comes every year. Memorize this picture. Please memorize it. Bipolar neuron. If they ask you where is it found, in the retina and in the nose. They usually ask this. They either ask where is it found or they ask what type of neuron is this. Bipolar in the retina and in the nose. Okay? And this is a unipolar neuron, which is just a normal sensory, what's it called? Or motor neuron. Okay, so for neurons, you have to look at the pictures and memorize them. So this is a multipolar, 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 multipolar neuron. This one is a bipolar neuron, know where it's found, and this one is a unipolar neuron. I'm sorry if it's not it's not there is no way of explaining them. I'm sorry for that. You have to memorize them, honestly. I'm just telling you, I'm being honest with you, just so you guys know what to expect. Okay, because this question is likely to be seen in the exam, and they will ask you, for example, which of the following is a bipolar neuron, or which of the following is found in the retina? Okay, and the answer will be, for example, D, the retina or the bipolar neuron. This question asks about a unipolar neuron. This is a unipolar neuron. C. Tamam? Make sense, guys? Yep. Yes. Okay. Hopefully it's not overwhelming, like not scary to you guys, what I'm telling you. I'm just trying to help you out. I swear. Kind of. Okay. Okay. Where is the bipolar? Okay, I'll write it down. So this is bipolar. Bipolar in the retina and in the nose or nasal cavity or olfactory, whatever they tell you, you just understand it's in the nose. Tamam? Okay, let's go to the next question. So what type of neuron is this and where can you find it? Multipolar, exactly. See, now you're answering. Okay. Okay. And where do you find it? It's okay. It's okay. So I'll just pull the slides so you guys can see it. So I said so like 7 times now. So here it is. Multipolar neuron. Okay. You can find them in the cerebellum, Purkinje cells. That's one. Where else can you find them? In the gray matter, multipolar neurons. Okay. So this is why I'm telling you it's important. My slides are good. Okay, yes. Ventral horn, yes, that's a good answer. Gray matter, yes, yes, yes. You guys are answering correctly. Also, it's found in the cerebellum. Just keep in mind these 2 locations. I wrote them for you here in the notes. I wrote them here in the notes. Hello? Okay. طيب. What type of neuron is this, and where do you find it? We went ahead and answered this before, but let's practice and do it again. Perfect. Everyone is answering this. And this is so important, you guys. Inshallah, if it comes in the exam now, I'm sure you guys will answer it. Alhamdulillah. In the nose of Jerry, yes. Good answer. طيب. Are you guys able to answer this question, or should I explain it so you guys get the point?
Nodes of Ranveer, C.
Sorry?
Nodes of Ranveer, C.
Yes, C is nodes of Ranvier. What's B?
Myelin sheath.
Okay, what's A?
One more, axon.
Perfect, perfect. MashaAllah, MashaAllah, MashaAllah. So this is the white stuff here. Here, the white stuff is the myelin sheath. This is the axon, the line that's going through the myelin sheath. And these nodes that are stopping here are nodes of Ranvier. Why? So that we can jump from one action potential to another. You guys know about this, right? Perfect. MashaAllah, MashaAllah. You guys are doing great. Yani you're identifying most of the things. That's great. Is it because it devolved during preparation? It's not important to know this. Like it dissolved. Yeah, myelin sheath. Yes, the adipose tissue always dissolves. That's why it's empty. Which like okay. طيب. Can you guys answer this? And this has to do with the layers that covers the neuron. Just to give you a hint, basically. So let's see. Okay. Okay. So far, 2 answers are correct for 2 letters. Okay, the third one is there. Okay, last one. D. Nope. I mean C, sorry, not D. C, yes, and O, perfect. Schwann cells are the ones that are labeled SC. I didn't unlabel them. You can see them. So, we have 3 layers. Okay, and the neuron is like this, and then we have bundles inside it. And then we have smaller bundles inside it. Okay, you guys get the point. The most outer thing is epineuron, neuron, okay? And then the one that's here, it's called peri. Peri means around, okay? I mean here, the one that's here. And the one that's most in is known as endo. Okay? Can we say myelin instead of Schwann cell? No, because this one, Schwann cells, we're pointing at the nucleus. Myelin sheath, we're pointing at the myelin itself. There is a big difference. Okay? Schwann cells do form myelin. D is the myelin. D is myelin sheath. C is what's it called? Endoneurion. B is what's it called? Perineurion. And A is epineuron. I hope that made sense. Okay. I'll repeat it again. So A is epi, and B is peri, and C is endo. So these are the three different layers. So this one, epi, is the outermost. This one, the outermost. Peri is the one that surrounds each nerve bundle. Oh, not nerve bundle, sorry. These like smaller bundles, okay? And inside these, there are like small endoneurium, or zoomed in here, we will see it, the endoneurium. This whole thing that's around the axon is the endoneurium. Does that make more sense? Perfect. So the whole thing that surrounds the whole nerve is the epi. The one that surrounds the smaller bundle is peri. The one that surrounds the smallest bundle, or the actual axon, is known as the endoneurium. Surrounding the axon itself, like the axon itself, is the myelin sheath. Around the myelin sheath and the axon is what? The Schwann cells. This is like everything included in the past 1 minute of me speaking. Is it clear? Malak, is it clear? Yes, okay. Fine. Okay, so now we're done with the histology for the neuro, the connective tissue, and the epithelium. Before I move on, I want to ask you guys, do you have any questions? Yes or no? If you have a question about something, let me go back to it to explain it. No, okay, we can move on. Fine. Okay. Do you guys know morphology pictures for the blood smear or no?
Yes.
Okay, perfect. Type. Someone answered already. Neutrophilia, perfect. Okay. So these are neutrophils. When we see too many of them, we call it what? Neutrophilia. Hello? Okay. What type of cell is this?
Basophil. Lymphocyte. It's lymphocyte.
Lymphocyte, yes. Why is it not basophil?
Because it's not fully covered. Like basophils has a lot of granules and it's very dark.
Yes, perfect. Okay. Fine. I want someone to answer this in the chat. Mm-hmm. Perfect. You guys answered it. So A is a band cell, or the left shift neutrophil. Okay. D is an actual neutrophil. Not all of them are an actual neutrophil, but this one is like a just normal neutrophil. C is an eosinophil. Why? Because it's pink. B is basophil. Okay.
Would the bottom left be a monocyte, or would it be like a precursor of band cell?
Good question. I would say monocyte, but it also could be, because I'm not the only reason I think this exact slide is in Dr. Rayhan's what's la ilaha illallah, in Dr. Rayhan's lecture. Yeah.
morphology.
There is a reason he didn't put this, for example, because it's something I think advanced for your level, for my level. You know, it's
I
for him
think
who has been seeing it for years. He recognizes it.
I
If he's
think
gonna
this
bring
is
you,
a precursor. This is a precursor because it
maybe,
has granules.
yeah. If he's gonna bring you a monocyte, he's gonna bring this. Wait.
I think it would be an agranulocyte. No, it is an agranulocyte.
Yeah. So he's gonna bring this exact same picture. Hello?
والحين the morphology في OSPE, it's everything is going to be from this exact same slides.
Wait, one second. Okay. So let's go to next question.
This would be sickle cell anemia because there's sickle cell and target cells.
Perfect. So these are the sickle cells. And yes, you would call it sickle cell anemia. Simple, right? طيب, let's go to the next one. This one is a bit more
Iron
advanced.
deficiency. And there is
Teardrop and
erythrocytes,
pencil.
teardrops, and
So which one is teardrop? Which one is pencil? Which one is the black arrow?
the teardrop would be the green. The elliptocyte would be red. And would the black arrow be hypochromic?
Yep.
لا, hypochromic.
Hypochromia, yes. Perfect. MashaAllah, MashaAllah. Is everyone clear on this? Oh, MashaAllah, you guys are on top of it, MashaAllah. طيب, what is this?
Megakaryocyte.
What do you get from this?
Platelets.
Perfect. خلاص, you know this.
And
Okay.
and what helps into like breaking down megakaryocytes, it would be thrombopoietin.
Thrombopoietin, yes. Okay, yeah. طيب. So this is how you're usually asked.
First, because it has an R rod.
Yep, that's the answer. Perfect. MashaAllah. I feel like I didn't do much teaching in this session. You guys already know the answers. Okay, all good for blood smears. Is there anything you want me to go through, or should I?
Allah, alhamdulillah, that this is pretty much the easiest slides.
Alhamdulillah.
Like morphology, I'd probably say it's the easiest. Alhamdulillah.
Alhamdulillah. Inshallah, everything will be easy. Don't worry.
Inshallah.
Function usually asked. I don't know. Like it depends on the exam. There's really not a single like. There's no like rules for the questions they put. So, inshallah, لا, inshallah, you'll do great in everything. Don't worry. طيب. Do you guys know how blood grouping works?
Yes.
Okay.
Yes. The first tube, it should be the A antigen. If it's up, the A antigen is found. If not, then it's not found. Same thing for second one, but for B. Third one, it's for the D antigen, which are plus or minus.
خلاص, we'll make you co-host. يلا.
لا والله.
MashaAllah. Yeah, pretty much as Yasser explained. You can see a positive reaction here. So this is A. Okay, we look at the RH. Is it positive? Yes, it's positive. So it's A positive. Simply. If both are negative, it's O. If B is positive, it's B. If B and A positive, AB, and you get the point. تمام? Yep. Just one thing to keep in mind. If both A and B are negative, then it's O. حلو؟ حلو. اوكي تمام. طيب. Okay. Wait, let me see how many more. Okay. طيب. We have, alhamdulillah, we have just a couple of slides left. And we're going to be done, inshallah. Okay. White pulp, yes. Okay. So this area, the one that's darker like this, is the white pulp. Okay. And this other area is the red pulp. Tamam? So in this spleen, we have two areas. We have the white pulp and we have the red pulp. طيب? Now, we have this, the central arteriole, and around it, we have something called, I think it's called the PALS, or the peri-arteriolar lymphocyte sheath. Something like that, صح? Okay.
Correct, actually.
Yes, okay. So these are the PALS. طيب? And then, once we zoom in the red pulp, we have two things. We have cords, and we have sinuses. So cords are made from cells. And sinuses are simply, so this is a sinus and this is a cord. This is a cord, this is a sinus, this is a cord. The sinus is simply the gap between them. Okay? So let's go to this picture. Can you identify what's this? Okay. If A is sinus, what is B? Cord. Perfect. So this whole thing, okay, just to orient you guys, this whole thing is a red pulp. Okay, it's a really zoomed in picture. It's fair if you guys don't recognize it. It's fine. Now these things, okay, are cords. And this area, the white gap, is the sinus or sinusoids. Hello? How are we supposed? They probably will tell you. Either they will tell you or they will do this. They will like give you this picture, or wait, let me pull up the slides. Okay. So they will give you this. They will give you this basically. They will give you this image. You see this image? They will give you this image and they will show you that it's zoomed in basically. Yani they will make sure that you know that this is the, and they might like just circle like this and be like, what are these structures? And the answer will be white pulp. Hello?
Excuse me, what is CA?
Central arteriole.
Okay, thank you.
No problem. Will they tell us what image? Sometimes yes, sometimes no. But I'm telling you, they will give you the bigger image and zoom it in usually. That's how it usually is done. Inshallah, you'll be able to recognize it. It's fine. You need to like this image, for example, you need to know that this is a spleen, for example. What else? Or for example, this is a lymph node, you know, just generally, any. recognize it. You don't have to like deeply memorize it, and you know, it's fine. You're good. Everything looks the same, trust me, to me too. But you have to look at it multiple times to get used to it, to make your eye used to it. Because now, for example, if I ask you this question again in 10 minutes, you're going to be answering white pulp. You're going to know this is a white pulp. This is a red pulp. If I ask you this question again, you're going to say this is the sinus, this is the cord. صح ولا لا? Or correct or wrong? You know what I mean? You just have to recognize it. You have to like do it more than once to recognize it. Don't over memorize it and stay like memorizing. There is important stuff, there is not important stuff, but just make sure you recognize it. And inshallah, you'll do great. Is most of the OSPE? No, not usually, no. It'll be like maybe 50-50. And there's also his heme now, so it's different. So no, not most of it is histology, no. Okay. So for example, can you guys answer this question? B, yep, it's B. B, yeah. Okay, so the answer is B. Okay, why did I put this? Because this could come. Okay, so this is a spleen. Does anyone know what's this?
Thymus?
Yep, that's the thymus. Yep, perfect. Thymus. Does anyone know what's this?
Palatine tonsils?
Palatine tonsils. Does anyone know what's this?
Adrenal medulla?
What is that?
Adrenal medulla or something like that.
Uh,
Adrenal?
Lymph vessels or
Lymph
lymph
node.
nodes.
Lymph nodes, yes, lymph nodes. Okay, but it's important to recognize these four structures. Okay, so know that D is a lymph node, C is a palatine tonsil, A is a thymus, and B is a spleen. Why is it important to know this? Because they might ask you, for example, which of the following, a patient came to the clinic with enlarged lymph nodes. Which of the following is the histology of the lymph node? The answer will be D. Hello? Because this is the lymph node. Or they will tell you this patient has basically tonsils, like problem in his tonsils. The answer will be C. He has splenomegaly. The answer will be B. He has a problem in the thymus. The answer will be A. You know what I mean? They could play with the question and just prepare yourself by recognizing this. This is A is the thymus, B is the spleen, this is the palatine tonsil, and this is the lymph node. Okay? May you say the first question again? So they will say, for example, the patient came to the clinic with enlarged lymph nodes. Okay? Now, which of the following is the histology of the lymph node, of a lymph node? And the answer will be D, because that's a lymph node. It's fine if you don't recognize it now, because you still have time to revise and memorize it. I'm sure if you just take a look at this one or two more times, you'll just recognize it by yourself. Okay? طيب. This is now a bit more specific. A is medulla, B is cortex. Perfect. You guys are answering this correctly. So we have here the cortex, this area. And this area is the medulla. Hello? In the cortex, we're having these germinal centers. I don't know if you guys have to know about this or not, but you just know that there are germinal centers. Okay. So this was for the lymph nodes and for the spleen. Is it clear, or should I go through anything specific you guys want to know about?
Can you please go back to the lymph node slide?
Sure. Which one? This one?
Yes, this one.
What about them?
Do we have to know the GC label thing?
The what?
GC or
You mean like the cortex and the medulla?
no, the cortex and the medulla are clear, alhamdulillah. I'm just
لا,
asking
لا,
the
germinal
GC.
center, you mean? Not from this far. Do you know how it looks like up close or no?
I think so, yeah.
Yeah.
It's like a
If
circle with
if you know how it looks up close, that's fine. You don't need to know from here. No. That's understandable.
Okay, thank you.
But يعني بالأخير, it's just a circle that's like a bit pale inside.
I want to make sure about something. In the cortex, we have germinal center, which is surrounded by maternal zone of right?
Sorry, surrounded by what? You lagged?
MZ maternal zone.
Marginal zone?
Okay. Yes, which is
Yes. Okay. Yeah. I'll show you guys. Since you asked, I'll show you. So someone is asking, can you tell me what's A and B again? So A is the medulla. By the way, you guys, everything in the slide is written in the notes that I didn't, like all the answers are in the notes. And B is the cortex. And I'll provide you with the slides after I finish. Hello? Okay. طيب. So here it is. So this is a germinal center. This is in the spleen though. Germinal center and the marginal zone. It's the same in all lymphoid tissue. Again, germinal center, germinal center, germinal center. Germinal center, marginal zone. Makes sense. Okay? طيب. Is it clear or should I move on? We have 2 slides left. I know, I'm sorry for taking a long time. I'm really trying to make you guys get the highest mark. طيب. So what's A? This is in the thymus, okay? No, in the thymus specifically, okay? Yes. Whoever is answering the Hustle corpuscle, you're right. Corpuscle. To be honest, we should be. Why are you saying sorry? It's fine. It's completely fine. Okay, so before you guys freak out, if you didn't recognize this, I'll show you this on the slides. In the thymus here. You can see my screen, صح? I'm sharing the whole thing, right?
Yes.
Okay, perfect. So this is the thymus. They will show you this is the thymus and they zoom in, okay? There are multiple things you should recognize in the thymus, okay? They might ask you about at least. This thing, the circle, the small circle, is known as Hassel's corpuscle, okay? And they might ask you about this, the macrophage, okay? I don't think they're going to ask you about this. This is very small. Or about this, the ERC. But let me zoom in just to get the closest view of it. This is the ERC. But it's important to recognize macrophages. I remember we were asked about the macrophages specifically. Am I lagging? How to differentiate between the germinal center and Hassel? That's simple. I'll show you how to differentiate. Hassel corpuscle, it's like literally just a small circle with like 2 dots, 2 nuclei on it. Germinal center, I'll show you. Sorry, just another image I'll pull out. Okay. Look how many nuclei are there. There's so many. So many dots, so many nuclei, and there's like this so many nuclei. It's much bigger aslan. Okay. Is it clear, everyone? So what is this? Yep. The answer is macrophages. You guys are right. Okay, so before I end the session, I just want to make something clear, for you guys. First of all, is this clear that it's a macrophage? There is no explanation in it, honestly. And I understand it's very confusing. You just have to memorize what's written. So like, this is a macrophage, you have to memorize it. Take my word for it, at least, and that's normal. You're not a histologist. You just got started in medical school. It's very difficult to recognize these on your own. So yeah, it's very normal. I understand that. And yeah, ERC is endothelial reticular cell. طيب. I advise you guys, my best advice for you guys is to look at these pictures more than once, okay? And you just go through them, even if it's just looking at them multiple times. Because if you look at it, for example, for once, okay, you're gonna be like, oh, what is this? I don't know what's this. First time you're gonna read, you're gonna know the answer, okay? You're not gonna know the answer, you're gonna read the answer, okay, you're gonna be like, okay, this is this. Next time you look at it in 10 minutes, you're gonna be like, oh, okay. Maybe you'll forget it, it's fine, but then you'll remember, you'll recognize it. Third time, خلاص, you know it for sure, you know? And this is another example, for example, for Husserl's corpuscle. Okay? So this is how you do it. You just have to go through the images and try to memorize them and recognize them. Okay? This is my advice for you. Okay? It's not like blood smears. Blood smears, the difference is very obvious. Here, the difference is not very obvious. You're just looking at different colors and just like white, pink, purple. And if he recognizes you do, if you don't, you don't. You know what I mean? And that's very normal. It's very, very normal. That's how it is. Yes, whoever is saying it's like much bigger and it can't tell the difference, it's fine. Just know that this one specifically is a macrophage, okay? And this one is ERC. And probably you'll be asked about macrophage, maybe you'll asked about ERC, but just recognize this image, memorize it. طيب. Is there any other questions that you guys have at all before?
Yes.
Yeah, sure, go ahead.
The nervous system,
What about the nervous system?
the parasympathetic and sympathetic, the nerves.
Parasympathetic and sympathetic. طيب. I'm not sure exactly what your question is, but I'll explain very generally. Sympathetic is basically the rest and digest. Parasympathetic is rest and digest, and sympathetic is flight or fight. Okay, it's in my tabs. This one?
Yes, yes.
What?
The other slide. Yes, this one.
Okay, what about it?
The nerves. The preganglionic. The
Okay, so wait, so again, this is dorsal. This is ventral. This is the root. Both of these are root, and since this one is ventral, it's called ventral root, and this is dorsal root. Fine. We have also the gray matter. So this is the dorsal gray horn, and this is the ventral gray horn. Okay, is it clear so far?
Yes.
And then we have dorsal root ganglion. This has the cell body of sensory neuron. Okay. Okay.
Yeah.
And then here, because at the end of the day, we're gonna have actual nerves here. Okay. We don't want them to be only sensory or only motor. They cross here. So we're gonna have both sensory and both motor. And then we're gonna have something called the ramus, the ventral ramus and the dorsal ramus. Dorsal ramus will go and supply the back. Ventral ramus will go and supply the front or the chest and whatever. Is that clear?
Yes.
What else do you want me to explain?
Also
I'm
the
not sure.
sympathetic ganglion and the preganglionic, the one in orange and green.
Okay. Whoa, how did I do that? Okay, so the sympathetic ganglion. Okay, so what happens is that we also have this lateral gray horn. Okay, this lateral gray horn. What's the part present inside the gray matter? Like which cells and cell body? It's a multipolar neuron. Okay, and it's what's it called? The motor neuron, and we also have sensory neuron. So we have sensory neuron both in the dorsal root ganglion and in the spinal cord. This is too advanced. You don't have to know the details. It's fine. Fine. So the lateral, okay, where was I? Okay, the lateral gray horn is the one that has the body for the neurons that are for sympathetic. Okay, now these, what are they going to do? They're going to give, these neurons are going to continue here, and they're going to join to supply in addition to this. So we're going to have in the ones that has lateral gray horn, what is it going to do? It's going to have motor, sensory, and sympathetic supply. Okay,
Okay.
is it clear so far? Okay.
Yes.
And then it's going to go through the white ramus communicants and then go up to a different level or go down. Why does it go up or go down? Because
To supply, I think.
yeah, because the sympathetic is called thoracolumbar outflow, right? So it's only present in the thoracic and the lumbar level. So the levels that it's not present at, it has to go up or go down to supply for these levels. So we have we have sympathetic supply in the spinal cord from is it T1 to L2 or what was it? I don't remember.
Yes.
Okay. Yeah, T1 to L2. And for the different levels, it's going to go up to go with the other nerves. Okay.
Okay. Can it go only down and only up?
What do you mean only down? Yeah, it's fine. But these are details again that you don't need to know. They're not going to ask you this.
These nerves?
Which one nerves?
The ones that you're teaching right now, they're not gonna ask about them?
No. I'm saying like the details of going up only
okay.
or going down. Yeah.
I want to ask a question. This presentation, it contains it isn't in our objective for this session. So do they have the right to ask us about it, or because they showed us the information, or it will not be included because it's not in the objectives?
You're lagging a little.
I think she meant that that we learned about this, but it was not in the objective. So do we have the right to appeal, or will it not come because it wasn't in the objectives?
You mean like you learned about this in the autonomic nervous system lecture, but you didn't learn about it in OSPE, right?
We did. They
No, we
explained
learned
to
it.
us.
They explained it in OSPE, but it's not in the objectives of the OSPE. We
So
have a list
usually,
of objectives.
so usually
It's not.
it doesn't matter if it's in the objective or not. They can ask it anyways, but they probably won't. Like they 90% chance they won't, but they can ask it. If they explained it, they can ask it. But it's probably not. I'm telling you, don't worry about it. Okay, any other questions? Thank you, everyone.
With the hosical circle.
The corpuscle, this one? I didn't hear you. Can you repeat?
Sorry. How can you spell hosical circle? Or yeah.
Horizontal corpuscle. This one. Do you know I just pressed exit to exit the PowerPoint because I don't know how to spell it myself. So, like,
Thank you.
it's fine. Don't worry about it. طيب. Okay. طيب. Thank you, everyone. You have to scan this code apparently. I don't know what it's for, صراحة. But you have to scan it. I hope this session was helpful. I really tried my best to explain everything. Inshallah, all of you will do well. And I really hope that this somehow helps you remember some of the stuff on the exam. I'll send you the slides on somewhere. I really hope it helped. I don't know if it did. And it's a bit complicated. I understand. It's a bit complicated. It's your first block. It's so hard to understand everything at once, and it's so overwhelming. But inshallah, you guys will do great. I believe in you all. Reaching this far is already enough of an achievement to work this hard. And just I want you guys, like, word of advice. Leave your phone for the next 2 days. Focus on yourself. Work hard, and you're gonna score well, inshallah. If you're feeling like you're lost, you're overwhelmed, you need help with anything, please let me know. My contact is there. Everything is there. You guys will do great, inshallah. It's your first block. Try your best, and don't worry. Don't worry about the exam. Inshallah, you guys will all do great. Do you have any other questions? Do you have anything that you want me to talk about? You can pause the recording. I stopped the recording, by the way, here.